Senior doctors have called on the government to shorten the gap between the first and second doses of Pfizer-Biotech coronavirus vaccinations. In a letter to England's chief medical officer, which has been seen by the BBC, the doctors' union, the BMA, called the gap of a maximum 12 weeks difficult to justify and said it could potentially undermine the effectiveness of the jab. However, the government argues it could save lives by allowing more people to receive a first jab more quickly. Our health correspondent Anna Collinson reports.
They're used to taking care of others, but they're now the ones being looked after. Today, thousands of health and social care workers, like here in Glasgow, have been receiving their coronavirus vaccine.
Get the vaccines out, obviously do your dosage counted.
And from Scotland to South Wales and the Lynn Peninsula, this pilot aims to reach those who are unable to travel to the larger sites.
Very pleased and looking forward to the next one.
But while the rollout rolls on, so do questions about the gap between the first and second dose. As pressures intensified on hospitals in December, the dosage gap was extended to 12 weeks. The UK's chief medical officers said millions of the most vulnerable were more likely to become severely ill without a jab, and this was the best way to reach more of them quickly. But some senior doctors want the interval for the Pfizer jab reduced to 6 weeks.
That would still allow many more people to have a first dose compared to a 3-week interval, but at least it would be in keeping with international best practice guidance. There is no other nation internationally that has adopted a 12-week delay.
Data suggests the Oxford-AstraZeneca vaccine is still effective when doses are given 12 weeks apart, but Pfizer only has data for the first 3 weeks. Even so, many scientists have defended the UK's current approach, calling it a balance of risks.
I totally support the decision to extend the gap between doses. I think looking at the evidence in total, I think that is strongly supportive of that. And I think on this particular occasion, the BMA has probably got it wrong.
Ministers say the current process is the right move and will be particularly keen to reassure anyone who has concerns. This mosque in Birmingham is the first in the UK to become a vaccination centre, one more measure to try and reach the most vulnerable. Anna Collinson, BBC News.